Good morning to you. Thank you so much for being with us. The show is Good Morning Africa. My name is Miriam Ogutu, and it is a pleasure to have you on board today. We have so much to talk about, but before I bring in my panelists, I'll take us through the headlines this morning on the leading newspapers here in Kenya, and we start with the Daily Nation. The main headline, the big standoff, will Raila show up? There is still the chance that, like Dr. Ruto before him, Mr. Odinga will ignore bad advice and agree to take part. If so, the stage could be set for a riveting duel between a younger and nimbler master of the debate platform and an older opponent with a stellar record in the quest for human rights democracy. And the face of the presidential debate that is meant to be happening today. And of course, Raila Odinga and his team has said that he has no intentions of participating on today's debate. And so the Daily Nation is asking, will he change his mind? Nithi Bridge bus crash, the ones we lost, and the highlight of the people that unfortunately lost their lives due to that unfortunate accident. Right now, the number of people that have been confirmed dead by yesterday from the Sunday crash stands at 34, and an outline of some of the faces there. The search for a perfect body, that is on the healthy part, the pullout on the Daily Nation. Special report, Rigathi Gachagua and the making of Mr. Moneybags. He does not flaunt his riches and neither does he leave it off. But the Mathira Member of Parliament is at the center of a complex network of deals that have earned him and his associates billions of shillings. That is on page 13. Moi said he would have fired Ukov if he did not trust him. And the shocking details of ritual and witchcraft in his state house. That is a book review on Linjiro. A book review that has been going on, I think, since over the weekend on the Daily Nation, and that story is on page 3. We turn our attention to the Standard newspaper. The main headline, IEBC defends trio as Central Farm goes quiet. Chebukati claims deal with Smartmatic and its local agent. Seamless Limited is above board, but the mother company is yet to come clean on the matter despite assurances. That story is on page 4. Kenya gets 7.5 billion Kenya shillings loan to stabilize flour. Oil prices, that is on page 25. Plunged to death. Country mourns 34 Nithi victims. That is on page 6 and 7. Raila promises boda riders 1 billion Kenya shillings fund. That is on the national page. On page 13, Harare to use gold coins as currency. Okay, that is on page 27, and 10 medals, hits and misses at Oregon. That story is on page 38 and 39 on the sports pages. On the Standard newspaper, we turn our attention now to the Star newspaper. The main headline, lucrative Uhuru and Ruto pension packs. Kenyatta will also get personal assistants, secretaries, messengers, drivers, and guards. That story is on page 4 and 5. Head of state opens multi-billion shilling Uhuru Gardens to the public. That is the main pictorial, and the main story is on page 2. DP Ruto begs Raila to attend much-awaited presidential debate. That is on page 6. I'm heartbroken to lose boy I rescued from bus crash scene. I think that is from a witness on page 2. On the Star, and Kinoti to grill IEBC Venezuelans behind the importation of the stickers. That story is on page 6, and that is a story that has been developing and ongoing, and we shall just shortly look at that before we look at our main topic of the day and keeping up with President Uhuru Kenyatta's legacy. And today we shall be paying a spotlight to the universal health care and how much perhaps change has been effected with the Jubilee government since President Uhuru Kenyatta first became president in the health sector of this country. So that is what we shall be looking at. Right now, I'm joined by Samuel Tawish, a journalist and in-house analyst from Nairobi. Samuel Tawish, a very good morning to you, and thank you so much for finding time to be with us. All right, so as we wait for Samuel Tawish to join, I think is experiencing some technical difficulties there. We're joined by Douglas Kirimi from Meru County. Douglas, good morning.
A very good morning to you, Miriam, and also to my co-panelists, and also to our friends across the world. Good morning, good afternoon, and also good evening, depending on where they're watching us from. Thank you.
All right. Thank you so much, and nice to have you, Douglas. And we are joined also by Kiptanui Savania, all the way from Nakuru. Kiptanui, good morning to you.
A very good morning to you, Miriam. Good morning to my fellow panelists. Good evening, good afternoon to everyone, depending on where you are watching us from. Thank you for having me on this show this morning.
All right. Nice to have you. Tawish, can you hear me? Because I need to know that you can hear me, and then we can start our conversation this morning. Good morning.
A very good morning indeed to you, Miriam Mogutu. Good morning to my fellow correspondents, and good morning, good afternoon, good evening to all our viewers watching this program in Kenya, Africa, and the rest of the world.
Okay, so good morning to you, Tawish, and thank you so much for finding time. And the rest of you, and I think the rest will join us as we continue with this conversation. As I said, our main topic of today is we'll be keeping up with President Uhuru Kenyatta's Big Four agenda and legacy. And we know in the Big Four agenda, health is one of the key pillars of that agenda, universal health coverage. So we will track how much President Uhuru Kenyatta has been able to achieve so far, and perhaps what the next incoming government will have set up for them to continue with the work that has been started, and some of the misses, or even some of, we will see when we come to that. But I think the story of IEBC is something that we can't ignore. That is because it is what is on everybody's mouth this morning, making headlines. So there is a press release that Chebukati IEBC had in the mid. I don't know why IEBC has a habit of releasing these important press releases in the middle of the night when the rest of us are asleep. These are things Farmajo used to do. Remember when he used to have a problem with Kenya? So we'll wake up in the morning and we'll find that Villa Somalia had released a very important press briefing in the middle of the night, which is against diplomatic protocols. You should not be releasing a press release in the middle of the night. It's disrespectful and out of order. And so Chebukati, I guess he's busy. So perhaps he had a very long day yesterday. He did not have time to sit down and write. And perhaps we'll look at part of that later. But page 6 on the Star newspaper, let's see the latest, and then we can look at what Chebukati said, and then we'll just jump into our main topic of today. Is it page very well, page 6. The 3 Venezuelans linked to the importation of election stickers are to appear before the DCI on Tuesday for second round of questioning. They were arrested at Jomo Kenyatta International Airport while importing Independent Electoral and Boundaries Commission stickers. Jose Camargo, Gregorio Joel Gustavo Rodriguez Garcia, and Salvador Javier Suarez were arrested on Thursday and questioned before being released for further questioning. Police confiscated the travel documents. IEBC chairperson Wafula Chebukati protested taking the 3 before the DCI, saying it would inconvenience the Electoral Commission, whereas the impression created by the press release is that the personnel have been released. Their release was conditional as they have to appear before the OCS Anti-Terrorism Police Unit on July 26th, he said. This inevitably affects the performance of their duties. Police were also holding the stickers, and Chebukati said he's hindering their work as they cannot prepare seamlessly for the elections. He said police confiscated all of the men's electronic items, including mobile phones, laptops, and flash disks. He said the electronic items contain important and sensitive information relating to the forthcoming elections, as well as projects undertaken by them for other countries. But also on the media release in the middle of the night, I don't know if I can find it very quickly so that we can just have a quick conversation over this. Chebukati said, because here he's saying this, whatever that is being held by the police is very crucial as far as the preparation of these elections is concerned. But in this media release, let me just read a point there. I saw that whatever that was, because it's on point form. So point number 10, for easy identification of the KIEMS kit, Smartmatic is required to provide stickers to aid in labeling each of its kits for purposes of packaging and dispatch to all polling stations. The deployment of the KIEMS kits is currently underway. And then number 11, it is important to note that the stickers are not strategic election materials. So if here you're telling us that this will hamper them not, preparing and helping us prepare for these elections. And then on this press briefing last night, you're telling us that, the stickers and non-strategic elections materials, because according to the IEBC, these were the only election materials that were in their that they had. But on the previous one, he's bringing the issue of their flash disks and their personal computers that is being held by the police. So which is which at this point, Samuel Tawish? Chebukati seems not to pick an issue and run with it. Are they the things that are being held by the police? Are they part of our electoral to help us prepare for elections or not at this point?
Miriam, it's very, very funny, and I'm sure from where you sit, you must be appreciating the fact that Chebukati is more of a confused chair of the Independent Electoral and Boundaries Commission. Miriam, Chebukati appears also to be in conflict with his own conscience, because at one point he says the police hampering the preparation ahead of the election, stressing that the election materials that were allegedly confiscated at the Jomo Kenyatta International Airport were very critical and essential in preparation for this election, only for him to turn around again and say they are not as critical as it were. So we cannot quite understand what is the true position of Chebukati. This is a man who has proved very indecisive, a man who is proving to be very, very incompetent. Because again, Miriam, it does not matter really how much prepared the IEBC is. It is also important that they are coherent when it comes to messaging, because you cannot be giving conflicting information. At one point, you're saying these Venezuelans were very key and strategic in planning or, of course, spreading the election materials, especially when it comes to electronic, of course, preparation. And at some point now, yesterday, he comes out again and refutes the claims and says again that these are not strategic or not very, very important as far as the preparation ahead of this election is concerned. I think Chebukati is just trying to play an escapist in the sense that if this election doesn't go maybe in the best way that Kenyans hope that the IBC should deliver this election, then we'll have an excuse that he was prepared and nothing really went wrong. I think it's just trying to confuse Kenyans with these kind of press releases. And also you notice that he didn't quite come out loudly to speak about every of the issues that the Office of the DCI had mentioned, or the press release that the Office of the DCI just gave the other day. I think it was on Sunday, if I'm not very wrong. So if Chebukati has not given an account or a blow-to-blow response of the presser that the DCI gave on Sunday, then we cannot quite take Chebukati very seriously that is ready and prepared to oversee this election, Miriam. It is high time Chebukati comes out and owns and agrees that he is not able to conduct this election. And remember, when we are preparing for a repeat of 2017 general election, it is the same Chebukati who came out and gave a press release purportedly that the Electoral Commission is divided. He does not see the commission with the capacity really to oversee that repeat presidential election, only for him again to turn around a week later and say that he's prepared and the commission is prepared to have to oversee the election. But we also the kind of confusion, the fiasco that clouded that particular election, not only the repeat 2017 presidential election, but the general election itself, that is in 2017. So this is a commission, like I said yesterday, it is worse compared to what it was in 2017. And Kenyans should actually prepare themselves for a lot of mayhem. You're going to see a lot of mayhem if we still insist that we must go into this election on the 9th of August and with this commission as is constituted, Miriam. That is why most of us have opined that it is important for us to consider even postponing this election up until we have a commission that is ready, a commission that has the trust and confidence of the Kenyan public. Because short of it, Miriam, it does not matter if IEBC or ourselves forced to go into this election, yet we are not prepared even to have to accept the results or the outcome of that particular election, especially when it comes to presidential, Miriam. So this is not a matter of formality that we must just have an election, regardless of the grievances, regardless of the issues and concerns that are being raised by the stakeholders and observers, that this commission, whatever kind of preparation it has had, is not sufficient enough really to instill confidence, trust, and faith from the Kenyan public and every political or stakeholder in as far as this very critical exercise is concerned. Miriam, I submit.
Okay, thank you so much. So we're just looking at what appears to be inconsistent press releases that the IEBC has been releasing. And it's good that you brought to our attention that letter by the DCI. And when I was reading through the press release by IEBC last night, it did not address any of the matters that the DCI had brought forth. And the DCI had categorically said that Chebukati is being dishonest. And the fact that that is something that has brought out, and a couple of issues that the DCA pointed out that the IEBC accused the IEBC of not being consistent about and dishonest about. Chebukati did not bother to go into explaining or clearing some of these issues. Instead, I was just reading whatever IEBC released last evening appeared to be just a status update to let us know about how the preparations of the elections are going and to shed a bit of light about Smartmatic, their history and how they were formed and etc. But they did not really get into the nitty-gritties of addressing some of the issues that the DCI had raised, and the fact that the DCI called out Chebukati and said that Chebukati was being dishonest about a couple of issues, because IEBC had said that the police confiscated all of the men's electronic items, including mobile phones, laptops, and flash disks, and they say the electronic items contain important and sensitive information relating to the forthcoming elections. So that is the initial stand by IEBC. The letter last evening said, in the same point that I've read, point 11, it is important to know that the stickers are non-strategic election materials. And I think the stickers already were handed over to the IEBC. That is what the DCI told us, that after they actually, were able to confirm that these were property of the IEBC as far as preparation of our elections is concerned, they handed over the stickers to the IEBC. So as far as we are supposed to know from what IEBC said, then these people don't have any other important elections material with them or anything that has to do with the elections, but that is not the case. And so it is important to note that the stickers are non-strategic election materials. The stickers were printed based on the details of the gazetted notice published on 1st July 2022, the information therein. So even in the letter last evening, Douglas, the IEBC is addressing the issue of the stickers. It is not bringing in the issue of the personal laptops and the flash disks that initially the IEBC had said that this could compromise the forthcoming, had very important and sensitive information that could compromise the forthcoming general election. So at this point, the IEBC obviously is not being consistent with what it is saying over this matter. So what are we left to believe? Douglas.
Miriam, thank you. And also, I would also want to commend the president of Interpol and also the DCI, George Kenyatta, for bringing out the issues that we are fighting with Chebukati today. Mr. George Kenyatta gave out a brief and also a press release on the very issues that he's raising about the integrity of these elections, and also questioning the manner in which Mr. Wafula Chebukati and the commission is conducting these elections, or under the environment that they are bringing out the issues that concern this election. Mr. Kenyatta raised very pertinent issues that Mr. Chebukati has not been able to respond to at night when he was releasing his own press release. Miriam and DCI himself gave out a press release on Sunday, but it took Mr. Wafula Chebukati almost 2 days later to respond to the DCI. And I also agree with the DCI that Chebukati is hiding something from the people of Kenya, and I agree that Chebukati is the weak link between free, credible, and transparent elections, and actually democratic elections in this country, and also a great Kenya, because we do not understand how Chebukati cannot respond to the DCI when he raises very pertinent issues, especially on the conduct of the IBC or the commission or the chairman of the IBC, the way he is conducting himself, the way he is also just moving around and also making sure that these election materials, Miriam, move from one place to another without even the security that is required, even without the letters of origination from IBC or even letters of invitation from IBC, to make sure that at the end of the day, Miriam, we have free, transparent, and also free elections, democratic elections, sorry. But for me to also not understand how Chebukati just accuses the DCI of making sure that he has arrested his own people, that he claims that these people are working for the IBC and they are carrying critical equipment or tools for deployment of technology for this election, to make sure that this election is conducted properly, only to come at midnight, Miriam, and also write a very, very, very wrong press release saying that these are non-strategic election materials, which, from my perspective, Miriam, I believe that Mr. Chebukati has a case to answer with the DCI, and I urge the DCI himself, Mr. George Kenoti, to grill Chebukati and the commission so that we can be able to bring this matter to book, Miriam. He cannot respond to very crucial issues that the DCI has been able to raise, but he goes on a rant saying that these are tools and equipment that are meant for deployment of technology and that are very critical to this election, only to come out 1 day or 2 days later and accuse himself of a double speak and also tell us, the people of Kenya, or actually tell the DCI, actually the tools or the stickers or the laptop that you found on the personal phones of these people are not critical. They are non-strategic materials for this election, and actually go ahead and also not respond to the issues that the DCI has been able to bring to the fore. I believe Mr. George Kenoti is a man of integrity, is a man that is grounded in Christian values, that he cannot let this election be compromised under his watch as the DCI in our country. I believe the Director General of the Criminal Investigations Department of the National Police of Kenya, Mr. George Kenoti, is right and Chebukati is wrong. There is something that Mr. Chebukati is hiding from us. We believe also Mr. Kenoti does not work alone, Miriam. He has a continent of workers and also people who are committed to delivering credible intelligence to him and also to make sure that he serves the people of Kenya effectively. Equally, Mr. Chebukati, at the commission, he has workers spread actually across the country, and at the anniversary towers, he has occupied so many floors there, Miriam, trying to bring credible elections and also transparent and democratic elections in this country. But Mr. Chebukati is hiding something from us. I urge Mr. DCI, George Kenoti, please grill Chebukati and the commission for us to be able to get to the root of the matter and also to bring Chebukati to book. And I urge Mr. George Kenoti, please prefer charges on Chebukati because he is interfering with the democratic process of the people of Kenya for voting for the people that they want. And I also want to thank the DCI for bringing issues to the fore that Chebukati is keeping under wraps and Chebukati is hiding from the people of Kenya. It is a shame that the DCI has exposed you and he has exposed the underbelly of Mr. Chebukati and the commission and the people who are working behind the scenes and the schemers who want to bring this country down or maybe bungle this election, Miriam. Thank you.
Okay. And I think, Douglas, you say that, what is it, that the IEBC has responded to the DCI. The IEBC has not responded to the DCI. Matter of fact, I think even when they were writing, this was just a press release for the status update on how they're continuing with the preparation for these elections. They did not bother to even address some of the very critical issues that the DCI raised, and one of them, perhaps the questions that the DCI raised in the letter 2 days ago, was why was this important election materials, why were the authorities at the airport not alerted that this kind of material was coming in so that it was for it to be provided for with the security and for it to be facilitated in the manner in which the rest of everything else was being facilitated in? And why was this important elections material being carried by a person as a personal luggage? Okay, and it was not declared. And also, let me just read the last part of the DCI letter on Sunday. something that perhaps Kenyans were hoping IEBC would address. From the aforesaid invitation letters, it is clear that the three foreigners were in Kenya solely for business, with Abdullahi Abdi Mohammed applying for his personnel who he had contracted to come to his office in Nairobi for work-related activities, and not the IEBC. Why didn't the IEBC respond at least to these three very critical questions that the DCI, through the investigations, had found out, and perhaps IEBC was the right person to have these answers for? Why did IEBC not bother to respond to these questions, Kiptanui?
Thank you, Miriam. Thank you so much. Miriam, as we've said earlier, this is a deal which has not been struck yesterday. This is a deal between Chebukati and cartels. Miriam, Chebukati has pocketed a lot of money. You see, Miriam, there is no way that Chebukati could answer these questions because Chebukati is taking commands from Karen. Let us say there is somewhere Chebukati is taking command. Somebody is behind Chebukati, is giving Chebukati what he's supposed to say. If I was Chebukati, Miriam, and these things actually were true, I could have gone to the press, Miriam, and just respond. Because what am I hiding myself? I could have even prepared a very long, why 24 hours? Somebody was asking, why is it that Chebukati has taken 24 hours? And after 24 hours, he's not even responding to what he has been asked. If I was Chebukati, Miriam, with all those confidence, I'm a lawyer, I'm the chairman of IEBC, I could have come out and say, these are our people. These are the people they were supposed to come and fix these scheme kids. But there is a problem here. There is a contradiction between Chebukati. These people are revealing that we were not even coming to work for IEBC, but we are coming to work for Abdullah. Miriam, as my brother Douglas has said, let us grill Chebukati, let us grill the commissioners, all these commissioners, Miriam. And I know our able DCI boss, George Kinoti, as my brother Douglas have said, he is not working alone. He's a president for Interpol. He is getting intelligence from all over the world. If maybe he knew even when these people are traveling from Venezuela coming to this place, Miriam, there are a lot of things. This is the main reason, Miriam, that you saw one of the presidential contenders of the Kenya Kwanza coming out and accusing DCI that Chanel in IBC do this, because this is a web. This is a scheme, Miriam, that has been set. This is a scheme. Remember, Miriam, Moses Masika was also accused. But he came out and he said, I'm not even part and parcel of this. I'm a lawyer myself and a politician. I'm not even dealing with this. Miriam, there is a deliberate scheme to rig this election. And there is, as we are preparing ourselves to go and cast this vote, there is no longer confidence, Miriam. Let the DCI, I want to encourage DCI, Miriam, to do their work properly. Let us unmask all this, because, Miriam, there are only two things that are going to happen. There will be these elections, Miriam, either to be postponed or to be cancelled, Miriam, or to be nullified. There are sufficient grounds for this election to be nullified, and it will also plunge this country to chaos, Miriam. Miriam, can you see, for example, you see recruitment of agents, recruitment of returning officers in Kisi. Somebody has just come all the way from, I don't know from anywhere. Karen Kalenjin name, she was also accused of manipulating recruitments to favor the candidates, Miriam. So, starting from as we have said, elections are very long process, Miriam. Starting from hiring of the clerks and preparation, we are not prepared. We voters are prepared because we will go to vote. But Miriam, IBC is not prepared up to today. As man from Bungoma, Chebukati is still defending things that are on public domain, that these are wrong, Miriam. These are not the people that were coming to work for you. And Miriam, I said one time in this TV television that long time when we were growing up, Miriam, you just go and steal sugar. You wash your face, nobody knows that you stole sugar. But when your mother comes back, you are the first suspect. You unajitoa hata mwenyewe unasema sio mimi, and nobody has asked you. Why is this gentleman giving us press conference? Why is it that he's not coming during the day and give us this press conference? Huyo ni mkora. Thank you.
All right. Okay. Thank you so much. So that update from the IEBC was titled An Update to the Nation on Deployment of Technology in 2022 general election, and so it was not a response to the letter by the DCI, and that's why IEBC just stayed on to whatever it is they wanted to update us about. And the details are there if you want. You can find it on IEBC's, social media pages, I believe. Okay, we're joined by Gladwell Kirago before we move on to our main topic. Gladwell, good morning, if you could hear me.
A very good morning to you, Miriam. Good morning to my fellow panelists. Good morning to our viewers.
Mm-hmm. So you found us at the tail end of this conversation, and we were looking at the IEBC letter last evening that did not really respond to any of the issues that were raised by the DCI. And in the letter, DCI termed Chebukati as being dishonest, but the IEBC did not bother to respond to some of the issues that were raised. Instead, it was just giving us an update about its preparedness as far as the electronic part of our elections is concerned. Your thoughts?
Thank you so much, Miriam. And I'll start by saying, this issue of IEBC, I think it's an issue we just have now, because there's nothing we can do about it. And I said the culprit will happen to be Kenyans. Currently, we are the spectators, and that's why most of the people who are the supporters can't see anything wrong that is actually ongoing. Miriam, we expected them to actually explain, because there's no way you can still come tell us that you are ready for the election. Yet what is happening, you are not saying anything about it. So the first thing for them to show us they are ready, can they come out and explain what is happening? Because with those stickers being found as a luggage, that's more than meets the eye. They need to explain about it. They can't just tell us that they are ready. No, we can't believe them. So Miriam, can we postpone the election?
Okay, thank you so much. And of course, the Deputy President William Ruto has pleaded with Azimio rival Raila Odinga to attend today's presidential debate and face him head-on before millions of Kenyans. Ruto said the former Prime Minister should just prepare himself well for the event and use the platform to explain his agenda for the country. I will be there early enough because I have an agenda and a plan for Kenya. Attend the debate even if you don't have an agenda. I have a lot of questions for you, he said. The DP said Raila would have nothing to fear if he has tangible plans of moving the country forward. And of course, the UDA presidential candidate, however, blamed Raila for the economic hardships Kenyans are going through, saying his handshake with President Uhuru Kenyatta in March 2018 disrupted government agenda. And still staying with our story, the media, which unveiled a joint production for the presidential debate, faces a major test following Azimio presidential candidate Raila Odinga's decision to plan a parallel debate on Tuesday. Head of Raila's presidential secretariat, Makau Mutua, said Raila will skip today's highly publicized debate at the Catholic University of Eastern Africa. Instead, Makau said Raila will take part in a televised town hall at Jericho Social Hall in Nairobi's Eastlands with ordinary Kenyans as he listens to their demands and challenges facing them. There were indications that Raila could have engaged with the media later in the week. Raila's move could turn into a nightmare for local media that have invested heavily to bring to Kenyans nearly 5 hours of dedicated debate coverage and analysis. During the launch of Ruto's manifesto in Kasarani, some media stations were forced to split the screens to accommodate Roots Party presidential candidate George Wajakoya when he was unveiling his own manifesto. So today, that might be a similar case. I don't want us to go into that story, but I want us now to, because we don't have much time, I want us to turn now to our main topic of the day, and that is to look at President Uhuru Kenyatta's legacy on universal health care. And I'll start with you, Samuel Tawish, from where you sit and what has been achieved so far. What is your personal assessment?
Thank you so much, Miriam, and thank you for that question. Indeed, Miriam, we will agree that, sorry about that disruption, Miriam. You will agree with me that President Uhuru Kenyatta's administration has achieved immensely when it comes to universal health coverage in the country, one of the key pillars of the Jubilee administration. And I think when you move around, today is not the same case as it were years back before President Uhuru Kenyatta came into power. Because today more health facilities have been constructed in the country. You'll also agree with me that mothers today will be able or have been able to access these health services really with minimal or with minimal if nothing when it comes to the issue of fee or charges for that matter, Miriam. And I think this is something that has been long overdue, something that should have been embraced long time ago. We do not want to live in a country where our people are struggling just to get medication, one of the basic needs for any human being, Miriam. So when you have President Uhuru Kenyatta actually prioritizing his agenda that universal healthcare coverage is going to be key in his administration or in his agenda, I think this is something that's very, very critical and important. And as we speak today, Miriam, you move around today, there are thousands of new health facilities which have been constructed across the country, of course, with the help of the county government. When it comes to medical supply, also, albeit with some challenges, but you'll agree with me that there's a lot that has been really achieved or done as far as making sure that we have drugs in our hospitals, we have drugs in our health centers, and also our mothers, especially those pregnant mothers, are able to be able to access these health facilities and be able to get these essential services in most of our hospitals and especially the public facilities in the country. Remember, Miriam, getting a healthcare service has been one of the major headache for most people in Kenya, especially those the middle income earners or even the lower income earners, because it's been very, very expensive, especially going to the private facilities. But with the universal healthcare coverage, Miriam, you are able to get or access almost similar services like one which anyone will get at a private facility. You can get at a public facility at relatively cheaper prices or no cost at all, especially when you look into the maternity aspect. So, Miriam, President Kenyatta has quite achieved a lot on this. We just want to hope that with the coming in of a new administration after this coming election, we want to see the same revitalized. We want to see increased construction of infrastructure or the facilities, the health facilities across the country, especially those areas that have been largely perceived to be marginalized, say northeastern regions, the parts of Rift Valley, the places people feel like they've been marginalized for far too long, that mothers and children still need to walk a very long distance really to access these very essential facilities and services. We want to see that gap being bridged so that every Kenyan from every corner of this country can feel to be part and parcel of this nation, can feel proud that eventually their government is able to provide these services from where they are at a very, very affordable or cheaper prices, Miriam. So that's something that is very commendable of President Kenyatta. We need to laud him even as he plans to, even as he prepares to exit from office in a couple of weeks or so after this coming election, Miriam. This one very big gift, I'm very sure the mothers like yourself and maybe Gladwell are very, very happy of what President Kenyatta has quite done, especially on the mothers aspect. Today, our mothers can be able to access these services free of charge, especially when it comes to maternity. And even for us fathers, we are also very proud because in the past, and even the prospective fathers, it has always been very expensive, really, to pay for these services. And therefore, we are grateful for our president that this is one very, very fundamental thing that he has been able to address during his tenure as president of the Republic of Kenya. I submit.
Thank you so much, Tawish, for bringing that aspect of fathers now have a relief when the wives are going to deliver. I mean, me and maternity, we were done so many years ago. But, you know, this is something that a lot of mothers and families are really appreciating because, and this has helped in reducing the death rate when a lot of mothers used to lose their lives when they're trying to bring a life to this world. So it's a relief, and usually we just look at it from the mother's perspective, but it's also a great relief to the fathers who have a lot of times to fork out, these medical bills. And right now you just go to a public hospital, you just have your baby, and you go back home without paying anything. And I've seen that from so many friends and family members that have benefited. But for me, Tavish, yes, hapo huko tulitoka. Now, the Kenyan government aims to provide medical insurance coverage for every Kenyan within the next 5 years. The changing healthcare landscape in Africa continues to make an indelible impact, with an emphasis on the implementation of the universal health coverage. By 2030, Kenya is in the process of defining a health financing strategy which will give impetus to Kenya's journey towards universal health coverage. There are extreme regional differences in the quality and distribution of care, with the best facilities located in Kenya's capital, Nairobi, and while the most undeveloped facilities are in northeastern province and parts of the coastal region. This is according to an analysis. And primary care facilities in rural areas often suffer from shortages of staff, essential drugs, and basic medical equipment. Some patients choose not to seek care due to the distance that they would have to travel to reach the nearest health facility. Only 30%, when this report was being written, only 30% of the rural population has access to healthcare facility within 4 kilometers of their home, compared with 70% of the urban population. So the disparities of even these health centers and how they are distributed across the country. And universal health coverage is one of the big 4 strategic pillars declared by the President of Kenya, which will see major policy and administrative reforms in the medical sector to ensure everyone has access to quality and affordable medical coverage. And that was supposed to happen by 2022. And President Uhuru Kenyatta is on a clock right now, TikTok, about 13 days to go. So how has President Uhuru Kenyatta performed as far as the universal healthcare is concerned, Douglas?
Thank you, Miriam. The president, from where I sit and from where I am, and from where I can authoritatively speak about the county of Meru, the president has outperformed himself. The Meru General Hospital, now known as the Meru County Referral Hospital, is one of the best facilities until was one of the worst facilities, medical facilities in the region until President Uhuru Kenyatta happened 10 years ago as the President of the Republic of Kenya. One of the very aspects of the Meru General Hospital, as we call it, is that the President has been able to bring the medical equipment to the hospital, and also the famous Meru Cancer Center. The Meru Cancer Center has received a lot of money from the President of the Republic of Kenya. I think, if I'm not wrong, the last financial year, the government gave over 1 billion Kenya shillings for the construction of the Meru Cancer Center. And also Meru being one of the regions that are adversely affected by cancer, the President has been able to outperform himself in matters cancer screening and also treatment and also kidney dialysis. Remember, Meru is also one of the regions in the country that is reading with kidney failures and also kidney-related diseases. But the President has been able to bring equipment for kidney dialysis at the Meru General Hospital, or now the famous Meru County Referral Hospital, that now we can be able to be proud of. We can be able to be proud of the fact that we can go to the hospital today and access better medical care and also access a bed at Meru General Hospital. At General Hospital before, you could not access a bed. 3 or 4 patients would sleep together. And I remember sharing this story with my father of blessed memory. And I told him that I wouldn't want him. I always wanted us to update our insurance so that we don't end up taking our patient or a family member or himself or myself to the Meru General Hospital, because I went there to check on a relative and also see how they are doing, that because they are admitted there. But at the end of the day, I ended up running away from the wards. But today, the capacity of Meru General Hospital, Meru County Referral Hospital, has been able to be expanded through grants and also funding from national government and the county government of Meru. We have a new facilities today that can accommodate more people, more wards. And actually, the now coming up Meru Cancer Hospital is one of its kind in the region. And I believe the next administration and the next county government of Meru is going to build on the vision and the plan of President Uhuru Kenyatta to also kick out cancer from the county of Meru and the regions that surround Meru County. Remember, the Meru General or Meru Referral Hospital serves the people of Isiolo, Laikipia, Tharaka Nithi, and Garissa, and other places, other surrounding counties, who come to seek for medical services from our county. That's why the hospital could not be able to accommodate people before, because we've been serving a larger percentage or a larger demographic or a geography of people that could not have been served well and properly at the former general hospital, the now county Meru referral hospital, that has now been expanded and can now accommodate people from other counties. And I'm also challenging other counties, please improve your medical facilities, increase your robbing skills, so that you can be able to lobby for better medical facilities in your region, so that you do not dump your patients or bring your patients to Meru, whereas people in Meru also require medical services and better services. And also another issue, Miriam, as I conclude, I have 3 issues to talk about. As I conclude on another issue is that the construction of KMTCs around the county and also around the region, the president has been able to bring up medical training facilities, increasing the number of trained medical personnel in the country that before were not enough in these facilities. These medical people, personnel, Miriam, that have been trained by KMTCs across the country, have also seen a number of medical facilities come up across the country, and especially in Meru. For example, KMTC in Maua relies on Nyambene Hospital to be able to take care of their training needs and all that. But at the end of the day, we end up having more doctors and more nurses and more clinical officers and other medical support staff for the same in these hospitals that could not be able to have this kind of personnel before. So I read the president score on that, because this has improved the medical experience and services for the people of Kenya. And the last but not the least, Miriam, is the maternal health care, mother and child. That has improved the lives of people tremendously across the country. And I remember myself and Jevan Karanja, Tawish, and others in Mombasa, we were interviewing people, and the first thing they were saying is that the maternal or mother and child care or primary care services by the President of the Republic of Kenya has really transformed this country, and they round him that for that, and they also thank it. It is the same story in my village. It is the same story in Meru town and every other municipality in Meru. We have the municipality of Maua, municipality of Timau, the same story, that the maternal healthcare services has improved the lives of people, and also made sure that economically our parents, our guardians, and also our relatives and friends and citizens of goodwill are not burdened by this very bills that are to be catered for when you take your wife to deliver in a public hospital. You just need to also register for the Reader Mama program, take that card with you to hospital, and that card is free of charge, Miriam. I believe that has really transformed the way we look at healthcare, and I believe this is a great challenge to the next administration or the next president of the Republic of Kenya, as our president prepares to leave the office in the next 15 days or 14 days or so, Miriam. Our president is going to go home a happy man, but the people of Kenya could no longer have their wives or relatives or guardians be taken hostage in hospitals. I remember in Meru General Hospital, the now Meru County Referral Hospital, Miriam, people would be jailed, literally, in quote, people would be jailed in hospitals. If you went there to give birth a kid 6 months ago, a kid will go home working, a kid that was not even born before you went to that hospital. By the time you cleared that bill, Miriam, it was too expensive, but we allowed the president. That is something that is very close to my heart. I have seen relatives benefit from that. I've seen villagers benefit from that, from my own village, and we thank the President of the Republic of Kenya. Part of the reason why his legacy is going to stand is that there are mothers and also fathers and parents in this country whose economic livelihoods or economic status could not have allowed them and their kids to be born in hospital to guarantee them proper services and proper Medicare. But these people now, Miriam, enjoyed the very best of their services. Even if this program is suspended tomorrow, if a bad president gets into office, I'm praying that Kenyans are going to vote for a president that is going to care about their mothers and about their wives and also their daughters and also their sisters. If this program is suspended tomorrow, the mother and child program, Miriam, I believe there are people whose the legacy of president who will be forever imprinted in their hearts, and also how it has saved them economically. And I'm very happy for that, Miriam. And we will be the president as he goes home. This is the legacy that lives on in the hearts, in the minds, and also in the history of the Republic of Kenya. Thank you, Miriam.
Okay, thank you so much. And of course, there's the issue of Kenya to some degree. I think we do have the best medical facilities, as much as we sit here and sometimes we feel we have a lot lacking in our healthcare system in the country, but we happen to be the medical tourism hub for the Eastern Africa. And so as much as we still have so much to achieve, also we do stand out in this region as having the best hospitals. And we've seen in the cases where even some very critical figures, some very well-known figures around this region have been flown into the country to seek medical treatment. And in the same case, we've seen Kenyans being flown out of the country, especially from the upper class, to seek for specialized treatment outside of the country, which I think is quite oxymoronic. But there are some treatments that you can't find in our local hospitals. So how perhaps can we improve this through public-private, partnerships? Kiptanui.
Thank you, Miriam. Thank you. Let me pick up from where my brother has just left. Miriam, we are so grateful here in Nakuru. I've been here for some time. And before 2013, Miriam, there were a lot of chaos. You see, from level 1, the level 1 is community, level 2, dispensary, level 3 health centers, level 4, district hospitals, level 5, and provincial hospitals, Miriam. All of them have been upgraded. Let me go back to the basic, to the level 3 health centers around this country, Miriam. Most of the health centers around this country, Miriam, have been improved. We have drugs, we have personnel, we have laboratories and other things, Miriam. Long time, Miriam, here in Nakuru County, you could even be brought from Maunaro, where I was last time, where I was covering, almost 35 kilometers to come and deliver in Provincial General Hospital here in Nakuru town. Miriam, without ambulance, without anything. By the time you come from that Maunaro to this area, Miriam, which is far, you could have even gone to distress, maternal distress. You either succumb or your kids succumb. But what is happening now, Miriam? Maunaro, where I was last time, they have a very good maternity. They are running NHIF, they are running Linda Mama. People are very happy. The other time I was around there. Miriam, we are in Rift Valley Provincial General Hospital, which is level 5, which is the largest referral hospital here. Miriam, last time I shared photographs with Steve and some of you about the biggest mother and child hospital around. It is inside the Rift Valley Provincial General Hospital, which was constructed by Uhuru Kenyatta administration with a cost of almost 450 million. It is now taking care of mothers. You can deliver here free of charge. You can. There is no longer what we used to call pin jail in hospital, Miriam, like my brother said. Miriam, NHIF came to rescue people. It has rescued a lot of people. They are no longer around-based, Miriam. Here in Nakuru, we have a very big health center. It was opened recently by our governor. Miriam, it has improved. People are no longer fundraising to take you to India for dialysis. We have dialysis machines. Miriam, you remember between 2013 and 2017, all counties were encouraged to take these machines. But what happened, Miriam? Cartels wakaingia and they wanted actually to use the governors. I remember the chairman of Council of Governors, the former Bomet Governor Isa Ruto, he was against this machine because they said we were not involved. They wanted to procure direct, Miriam, so that they get money. Miriam, a long time ago, we had chain supply management, which could take tax all the way from Embakasi, KEMSA headquarters to county, Miriam. It was taking 6 months for you to get amoxicillin. You go to the hospital, the clinician sees you, there is no drugs, you just go and buy. But Miriam, it has improved. The same chain management has been streamlined. Miriam, you saw recently the reforms which were brought to KEMSA. Miriam, you see, the same cartels who are in KEMSA during COVID, Miriam, they procured even some materials that were not even distributed to the counties. And people suffered so much and we suffered a lot of losses. That is why, Miriam, up to now, we want to applaud His Excellency President Uhuru Kenyatta. Miriam, there is something I want to say. Most of the private hospitals, Miriam, came up because People could not get drugs inside. And 80% of the people who are running these private hospitals around Miriam are the employees of these counties. They are employees, they are the doctors. Miriam, you just come to Nakuru one time and I will take you to the gatehouse. 80% of the clinics who are in the gatehouse are being run by consultants who are working in provincial general hospitals up here. Miriam, and they are reporting only on Thursday. I want to urge the next government to streamline these things, that let people who are being paid, who are consultants, Miriam, you want to see, you go to unit, you want to see a consultant, you are told, Lapana, put next week Thursday, and you are suffering. You want to see a dentist, put next week Thursday. He's only reporting on Thursday, but Monday to Thursday, he's running his clinics. Monday to, from other days, he's lecturing in MKU, lecturing in Mount Kenya University. Why don't you, actually, if you've been employed to run these things, Miriam, why don't you do this? Miriam, directly opposite, 20 meters from the Provincial General Hospital here, we have KMTC, Nakuru KMTC. We have Egerton University, School of Health Sciences. MKU are using this Provincial General Hospital to train. We have many interns around, Miriam. So this is what has been happening. Miriam, you go to Nandi County where I was born. You go to this county, we have every county, we have County Referral Hospital, we have KMTC, we are no longer having insufficient doctors. There is only one problem, Miriam, that we want to the next government to address: serial and yearly strikes. The strike up there, nurses, they strike today after finishing clinical officers, after finishing doctors, after finishing laboratory technologists, after finishing subordinate staff. What is the problem with these counties, Miriam? You saw Kirinyaga, they sacked some doctors recently because of the elections, because Uhuru wants to come back for the second term and come and mess up the county. You saw what is happening, Miriam. Miriam, there's a problem with President Kenyatta, you've done a lot, but there's a problem with county governors, county CEOs. Miriam, they're hiring these people on contract basis. You hire somebody contract 17,000. You cannot be able to feed this family, you cannot be able to do. Why do you think you cannot be corrupt? Why do you think, yeah, I'm a clinical officer myself, I see you in the morning, I can tell you that the machine, which machines in laboratory where we are supposed to be for diagnosis, malaria, other ailments. I can tell you the machines are not working. You just go to town in Nakuru, you pay 1,500. You at gatehouse, you are being attended. It's just X-ray, Miriam, X-ray which you can be done by provincial general hospital. You are told machines is not working. Why? It's because the same doctors they are working here are not even motivated. They have opened their X-ray, they have opened their CT scan in town. They just refer you there. You just go and then they tell you, don't buy drugs from here. I shared with you last time. 5 meters from the gate, there is a chemist called Milimani. What is he doing there? It is run by people who are working over there. Then with the next government, Miriam, and the governors, I want to watch you. Let us be mindful. We might have filled all these hospitals, but there is a lot of corruption on hiring. You hire people in contract, they just go. You don't pay them, they just be corrupt. So let us actually see in the next in future how we are going to do this, Miriam. I submit. Thank you.
Thank you so much. Gladwell Kirago, perhaps, what can the next government do to better further the healthcare system in this country? I think the rest of the panelists have highlighted key things, but your assessment and then perhaps what the next government can do to continue improving the healthcare system in the Republic. But so far, how do you assess President Uhuru Kenyatta's universal healthcare program?
Miriam, our president has actually done well on the health facility. But let me answer your question. The question you asked on how with the next government, or what should we do to improve the health facility both in private and public? Miriam, in public hospital, there's a disease that is there called negligence. Miriam, negligence is a disease that is actually costing so many patients' life. Miriam, for instance, if you have ever been to public hospital, maybe heard of this people speaking about it, you will be there by early in the morning and the doctor is not around. The person who is left to attend to you they are these students. Yes, they are students, yes, but Miriam, for instance, a hospital which is actually in Gatondo, whereby a woman died, whereby the scissors were left in her stomach during a CS. That was a student who did that. That is negligence. The doctor should have been there. And when I'm talking about health facilities too, Miriam, there's something that always clings into my mind, the renal unit. Miriam, 60% of the people in our country we are losing is a result of a kidney issue and cancer. And also, let me talk about kidney issue because it's a silent disease that, Miriam, not unless you actually recognize that you have it at an early stage, it will kill you slowly when you're actually so much seated, because it comes also with so many challenges, the challenges of pressure. So Miriam, with the private hospital on that issue, you find that there are these specialists, and mostly you find them, they're also there in public hospital, but they're not as many when you find them in private hospital. But what happens with these specialists? They tell you see them in their clinic whereby you have to pay. And when you see them in the private hospital, then there's a way whereby the hospital has also to get its money, and there's also a way that the specialist has to get his money. That happened to me once when I had the kidney issue, and that is what happened. Again, to find these specialists, it's also an issue, Miriam. Before you find a specialist, you'll have to tarmac. I was being treated by the late Professor Ware, and I getting him, it took me months to get connected to him. So that's an issue that we should address, that we should be having so many specialists who are actually available for the patient. Because Miriam, if I see you today, then you tell me my next appointment is 2 months, then that means the disease won't sit there waiting for the next 2 months for me to come and see you. No, the disease is actually spreading. I need proper checkups. And that's why most of these people consider this big hospital, whereby when they go there, they're actually not able to pay because the private hospital is expensive. The likes of Nairobi Hospital, they're too expensive for common Wananchi to afford it. Miriam, we have something like KU Referral, which has a 650 capacity bed. It's a hospital that is actually doing well. I was there, I did an assessment there, and it is doing so well. But again, on the issue still, the issue of negligence is also still being seen there. You walk there, you take your patient there, you are told to wait. Miriam, a sick patient can't sit down, wait for a doctor to come. The doctor who is being called is actually bringing his own things. The patient was there by 7. The doctor is he was walking in by 12. That's why you find so many hospitals, people actually dying when they're waiting on the waiting bay. On the issue of the mothers, I say Uhuru has delivered because there was introduction of the Linda Mama. That's when women parted ways with paying for the maternity bills. Nowadays, Linda Mama is actually standing for you everything, and that's why you can see nowadays the issue of maternity is becoming so soft, and most of these hospitals have actually been upgraded for the the Tondo Hospital. It's actually a level 6 hospital, but the issue again here, despite it being a level 6 hospital, Miriam, also the doctors always on strike. You find maybe only one doctor is available. Miriam, we have so many doctors. So at the same time, it's a wake-up call for the doctors. Be committed. Sometimes health comes first, more than the money you're actually striking to get. I submit.
Oh, wow. So many issues coming up this morning. But yeah, the issue of lack of specialized doctors in some of these public facilities, that is true. There's a very close family member I know that is seeking treatment from a government facility, and the kind of treatment that is required is from a specialized treatment. And the date they give you, you wonder, I mean, are we seeking for healthcare, or are we going for what? Because they need an immediate health attention from this specialist, and this specialist is not available to this hospital until after 2 months, like you've mentioned, Kiragu. So I think a lot of Kenyans are suffering because majority of us cannot really afford to go to the private hospitals to get these services quickly. So we will rely on the public hospitals. So I think this is something that is a challenge, and the next government must be able to address that. Facilities good when we have access to these facilities, but also quality. And I want to be assured when I go to these institutions, then I will get the service that I'm looking for. That is still lacking unless you're just going in there for malaria or these, treatable illnesses. But if you're looking for specialized treatment, sometimes it's really, really hectic for you to get it. So as much as we are making healthcare accessible by increasing the number of health facilities and also work on getting it affordable, can we improve on the quality? I think that is what Kenyans are asking for. But so far, I think there is some good points there. The government of President Uhuru Kenyatta has really worked on improving the healthcare system, but a lot needs to be done, and hopefully the next government will put the health of Kenyans at the top of their agenda and top of the things that they really need to reform moving forward, and adding to that list the issue of food security. I want to thank you so much this morning for your time. Samuel Tawish, Douglas Kirimi, Kiptanui Savania, and Gladwell Kirago. We will take a short break, and when we come back, we will continue with President Uhuru Kenyatta's legacy, and this time we shall be looking at governance. My name is Mira Mugutu. Good morning.